Good afternoon, everyone, and welcome to the Marshall University Health Informatics Virtual Information Session offered by the Lewis College of Business. Here's our agenda for the day. Obviously, the welcome, has already been extended to you. We'll have a short introduction by our dean about the College of Business, the Brad D. Smith Schools of Business. We're going to discuss a little bit about what is health informatics. We're going to get a description of the program. We're going to talk about some of the admission requirements, some of our benefits and job opportunities. And at the very end, we will have an opportunity for question and answers, and contact information will be provided for you. If you do have a question and think of it throughout the course of this session, please type it in the chat box. We have someone monitoring those questions right now when you type. So each one of your questions could possibly be addressed, providing we have the time to go forward. Just as a short introduction, we have our Dean of the College of Business with us, Dr. Avi Mukherjee. I am the HI coordinator, the Health Informatics coordinator. I'm Dr. Kent Willis. We have a couple of faculty members with us, Dr. Tracy Cristofero and Mr. John Byros. And we also have the Associate Director of Graduate Schools, which will discuss admissions factors with you, Mr. Wes Spradlin. Avi, if you don't mind, please take over from here.
Yeah, thank you. Thank you, Kent. Welcome, everyone. I take this opportunity to describe the university and the College of Business a little bit before you get to hear about the program. As you probably already know, Marshall is a university with a very rich history. The university has been around for more than 180 years. It predates the state of West Virginia. Business programs at Marshall started exactly about 100 years back, actually 1921, according to our research. We were offering business programs at Marshall. The business school has more than 50 years of history as well. So there is a huge history. There is a tremendous tradition of this university, including the We Are Marshall movie that many of you have seen probably, something that really talks about how the university came back. It's a story of resilience. It's a story of comeback, and it's a story of grit and determination that characterizes the university and its community. So we are very proud to be a part of Marshall, and we welcome you to be a part of this great university as well. Not only are we proud about the history of Marshall, but we are also proud about what we are right now, and we are excited about our future. So some of the things that truly make us apart: number one, we are a research university. We are designated by Carnegie classifications of higher educations as a doctoral university with high research activity, which is called the R2 category of universities. The only category above the R2 in research is R1, but I think we are very proud to be in R2 instead of R1, frankly speaking, because we focus on applications and applied research rather than being a purely theoretical research school. So we take pride in the fact that our faculty work very closely with our students. We create impact, engagement, and innovation in every single thing we do on a daily basis. So our research is applied, our teaching is experiential, and we put a lot of focus on innovation and design thinking, which has been the mantra, really the DNA of our College of Business. In 2 years back, we got a transformative gift from Brad Smith and his wife, Elise Smith. Brad was the CEO of Intuit, who left that role and became the chairman of the board recently. And he came forward, he's on the advisory board of the college, and he came forward with this transformative gift to truly reimagine the College of Business. We have been highly recognized among the leading business schools in the country by Newsweek, Princeton Review, US News and World Report, and a number of other ranking agencies. So we are really present, we are vibrant, we are noticed, we are recognized. We have a highly active and closely connected network of more than 12,000 business alumni, including CEOs of large corporations. The governor of the great state of West Virginia, Jim Justice, is a Marshall Business alum. We have many companies whose CEOs are from the Marshall Business School, including, for example, the CEO, of course, Intuit that you heard, CEO of Reuters in New York City, Hyundai America, the first American CEO of Hyundai America was a Marshall Business grad. The list just goes on. I also want to mention that the first woman CEO of a Fortune 500 company was Verna Gibson, who is also a Marshall Business School alum. She was the CEO of the Limited Stores that is now into brands like Victoria's Secrets and so on. So we have a tremendous history of this college and a network of very active alumni who keep coming back and helping our students succeed by mentoring them, giving them internships, and giving them job opportunities. We are also very global as a College of Business. We have several partnerships in China and India. And as you know, the Health Informatics program is a STEM program in business, which is really one of our great initiatives, I would say, thanks to some of our leading professors in this area you will hear from. We really offer a great combination of business and technology in this particular program and in other programs like this. So we are very proud to be able to offer business and technology together in the STEM business programs, which, as you know, gives a special opportunity for international students to opt for a 3-year OPT. Let's move on to the next slide, please. Thanks. And here what you see is a quick quote from Brad Smith and Elise, his wife. As you know, Brad and Elise are, are major benefactors of the college. We have created the 2 schools called the Brad D. Smith Undergraduate School of Business and the Brad D. Smith Graduate School of Business under the Lewis College of Business at Marshall University. By the way, the Lewis College of Business was named after Elizabeth McDowell Lewis. And as far as we know, we are the first AACSB accredited business school in the country to be named solely after a woman in the mid-90s. And so, we are very proud of our heritage again, and we have the future is with Brad and Elise Smith, who are leaders in Silicon Valley. If you read these quotes, you will see the kind of support we are getting from them. Brad and Elise are tremendously connected in the Silicon Valley and provide us expertise and connections, time, talent, and treasure, as we call it, every single day. And, if you just look at our CEO panel of the College of Business, you will see speakers coming and speaking to our students that are the top people in the industry. For example, the CEO of Intuit, the CEO of Adobe Systems, the CEO of PayPal, the author of the book In Pursuit of Happiness, Chris Gardner. We have had major celebrities come and speak in our college in just the last year, and it keeps growing. So we are extremely excited to have Brad Smith and Elise Smith with us, and all the faith that they have in us and in our programs as we reimagine the future of business education in West Virginia and beyond. Welcome, and I hand it back to Kent Willis.
Okay, Dr. Christopher, I believe this is your set of slides.
It does look familiar. So I do appreciate the opportunity to join the Health Informatics team and speak to you a little bit today about our Health Informatics degree and the certificates that we have. If you take a look at this first quote that's on the slide, it's from the American Medical Informatics Association, and it really focuses on using current and emerging technologies to leverage data so that we can create that knowledge that's needed and that can be used then to boost efficiencies, reduce costs, and ultimately improve our patient outcomes. If you take a look at the second quote that we have here, this one is from the National Center of Educational Statistics, and it defines health informatics, or medical informatics as it's also called, as applying the principles of computer and information sciences to advance science research, health professions education, and public and patient care. Okay, so 2 good quotes, I think, really give us an idea of what health informatics is and the definition of such. If we could have the next slide, please. Let's talk about the demand. Okay, so this first quote is from the US Bureau of Labor Statistics, and they're projecting that the growth in health informatics is going to be 15% between 2019 and 2029. And they're attributing that to, as we, or I should say me as a baby boomer, AKA an older person, is needing additional health care. The jobs are going to continue, and it's going to continue with the need to have these types of employees to be able to handle the growth in that occupation. The second quote there is talking about the 25 top master's degrees in health informatics and those that are most affordable. And that's quite the kudos for Marshall and our health informatics program to be there. The article then goes on and talks about that we're blending didactic and also experiential experiences that are needed in order to prepare these students to be leading professionals in the field and in the healthcare industry. So I think both quotes tell you that there is a demand. And I'd like to move on and tell you that certainly Marshall is the place to get that degree. And you can see we've got the background. Let's move on and talk about the actual program itself. And I'll turn that over to John Byros.
Thank you. Pleasure to be here today, and thank you for joining us today in the process. My name is John Byros. I was a retired professor from Marshall University after spending about 20 years in the information systems area. I was heavily involved in the health informatics program right from the very beginning and taught many of the technical courses, database management, warehousing, etc. in the program back then, in my days back then. I have a very special interest in this program because it's an outstanding program and I want to kind of share it with you. Before I get into the curriculum, I want to share a little story. A number of years ago, I attended a healthcare seminar with several of the students from the health informatics program. And one of the students was scheduled to give a talk. And she was really, really nervous about it. And when one of the CEOs recognized this, he walked over to her and he took her and said, to her, look at the audience out there. He said, you know, all of that audience out there, the only thing they can tell you is how we used to do it. They cannot tell you how it has to be done in the future. That, young lady, is your job. And I take that quote very profoundly when we do the health informatics area, because you're in a field, health informatics is in the middle of a field with two of the most dynamic industries going today, the healthcare industry and the information technology industry. Both are in extreme flux. What that means for us in the program is that curriculum is a moving target. There's rapid changes in these two fields require rapid changes within the program. So the course you take this semester, the course we look at this semester may be completely different a year from now, or maybe completely different even 6 months from now. But I'll come back to all of this later. Places to kind of stress. We've seen some of the changes already very quickly in this program, because you'll notice up above, I have the original programs. The original program was devised and put together by 3 colleges. It was put together by the Lewis College of Business, which is the Management Informations and Healthcare Administration. It was put together by the College of Engineering and Computer Science, and it was put together by the College of Health Professionals. We had 3 colleges that went together to form the Health Informatics program. What came out of that was go back to the first slide for a minute there. There we go, thank you. What came out of that program was the Health Informatics program that we have today. Amazing success immediately with this type of collaboration between the colleges. Within 2 years, it was accredited. That's phenomenal. Accreditation came very quickly at that point. The national recognition came very quickly. So there's a great deal to be said for this major thing of putting it together. Since then, it has already evolved, because now every one of these programs now resides within the College of Business. The Information Systems degree now resides within the College of Business. The Health Informatics resides within the College of Business. And of course, you have the Lewis College of Business involved. And what that does for us is it allows you to make dynamic changes very quickly. It really benefits the students to have this in the process. You can move very quickly in a very effective sharing of faculty resources. So we've seen this already, this whole notion of the dynamics of the industry moving very, very quickly in the process. So with that, Wes, can we go to the next slide? Instead of going course by course, I'd like to just attack this thing by going through the major areas within the health informatics program that you will be studying when you get into the program. There's the technical area, and we will have things like an overview of the health informatics. You will pick up the software, database management, warehouse management, healthcare. We have healthcare communications, technology, and telematics, the future of the healthcare industry and that whole thing. We have computer applications, hands-on with the hospital system. We have the research methods and data acquisitions for data analytics, or you'll get the hands-on the software at that point in time also. Let me pause for a minute. And let me just say that the title of the course will not necessarily tell you the full content of that course. Example, you see that one that says HIN 665, that's applications. Right, let me just put a real quick one on this one. That course is one where we cover the hospital system. And what that entails is a number of things. Well, for instance, if you bring up, there are multiple applications within the healthcare industry, within the hospital space, and they're all interrelated with one another. So in that case that says applications, if you bring up a screen, a registration screen, for instance, you see the information. What we try to do in this class and within the program is say, okay, where is that information reside that's on that screen? Where is it going? What does it look like? What's the database have to be that produces this kind of information? And when I hit the button on that, where does that information go? Where does it reside? What other applications does it have to interrelate with? So for instance, a little simple one, if you have a, let's say a simple one of a X-ray, it goes in for an X-ray. That impulse has to go to the radiology department. There has to be a scheduling that particular X-ray. But there's other things that are getting, all of this kind of get to an understanding of the technology that's behind whatever is in front of you, and where it relates, where's the data going to reside, what are we going to do with that data, how are we going to work with it. All of that comes out of these courses where you pick up database management, the analytics, the SPSS, all of that type of software process in the technology that's needed in the health informatics area. Wes, give me the next slide, please. Second area that we have in the thing is healthcare itself. And we have things like, for instance, the role of healthcare, the role of electronic healthcare records, quality and safety, legal and regulatory. Why do we need these? Well, for instance, in the role of the electronic healthcare records, those records are going to be stored out there for each patient. In there, you're going to find things like ICD-9 codes, ICD-10 codes. What do they mean? What's a DRG code? What's a CPT code? In a health informatics area, you have to understand the coding structure. You have to understand the records. We understand what's behind them so that you can do the analysis, because you're going to be doing analysis based upon these kinds of things. A particular DRG code. What are we finding out about those? Or ICD-9. So in the healthcare field, it is in the health informatics field, you have to have a good knowledge of the healthcare field in addition to the technology. The technology, well, coupled with this, allows you to do effective analysis of the data, which is what we're going for in the health informatics field. One more slide there. The other area within the program is the management area. It comes out of the healthcare administration types. So we have things like project management. That's the one course that's out of the area right now. That comes to the management school. The engineering management school. This is how to handle and code and sustain a general business management opportunities. The healthcare system, a total understanding of how that thing works in the process. Management of healthcare technology and information systems ties very closely to the technology things you will be getting. In this case, how do you manage that healthcare technology and how do you manage the healthcare systems? So it's the management piece of the health informatics program. Next slide. The other area that we have that helps you out with this thing is the self-guided studies. We have, in addition to the coursework, you'll get a chance to zero in on a particular area of emphasis that is yours or area you want to study. So independent study is capable, where you can pick a topic, research it, write a paper, do whatever you need to get a certification, but you have the ability to guide your studies into a specific area that you want to isolate. The other one is a practicum, where you'll be doing hands-on experience, probably outside the field, or writing a paper on this, however the practicum is going to be set up. These are individual study guides that allow you to zero in on a specific area and get further depth and knowledge on that particular area. So this system is set up with the technology, set up with the healthcare, set up with the management. One more, Kurt. Okay, the STEM set I already talked about, and we'll talk about that later down the line. But the STEM is a STEM program, and it is involved in all that. Last comment before I leave. Courses do not stand alone. They're all intertwined with one another. So in the technology courses, you will not only be learning the technology, you'll be learning about the healthcare and about the management. In the management courses, you will not only be learning about management, you will be talking about technology, you'll be talking about the healthcare field. And when you get into healthcare courses themselves, you'll be talking about the technology that's involved, as well as the management of that whole process. It's a great program. It's one of the pioneers of the concept of the interrelated, and it is maintained it all the way through. It's received national attention and certifications, which you will hear about later also. Great program. I'm committed to do it. I hope you all join it. Hope you have a good time with it. Thank you for your attention. Wes, it's back to you.
Okay, folks, just real briefly, I wanted to add something to what John has said, because I spent 25 years working in healthcare before I ever even started teaching at the, at a higher level. And I have seen much of this develop in a hospital and in the systems that we had to work with. And it's really quite interesting to see how things, have blossomed in the last 20 years as far as health informatics. So it is quite interesting. Let's talk for a minute about the accreditation of the health informatics program. We are accredited. It was mentioned very briefly at the very beginning by Dr. Mukherjee. We talked about the AACSB accreditation. Well, the entire school, College of Business, plus the Brad D. Smith Schools of Business, it is all accredited under the umbrella of the AACSB, the Association to Advance Collegiate Schools of Business. And what it does is basically it provides high quality standards for education. It helps you as a student. You graduate out of an AACSB accredited school, your opportunities become better. It also provides criteria where we have to, as a faculty, we have to meet certain standards. So you can see that this accreditation is in place to benefit not only you, but the school and the faculty. The second portion that is accredited is a Commission on Accreditation of Health Informatics and Management Education, known as CAHIM. And it is the individual health informatics accreditation, and it again supplies standards for education in these programs. It helps a graduate. You graduate from a school that is accredited by CAHIM, then you got that stamp of approval upon you, as well as the AACSB. And this also provides, that ensures that management skills and health informatics, the things that the student needs to be beneficial out in the workforce, are provided to that student. Next slide, please. We do offer within the curriculum a couple of certifications. One of them is a data analytics certificate. The other is a nursing informatics certificate. You can look at, much across the top there, 15 hours for the data analytics. You would have 3 health informatics courses, 2 IS courses. You can see the prereqs listed down through there. And it just gives you different opportunities in your career paths: data analyst, engineer, marketing researcher. I've known people that have actually done this and have gone into marketing research. A database administrator. Now, the nursing informatics certificate is 3 more hours. It's 18 credit hours, 4 courses in the HIN. A 200-hour practicum has to be served through the nursing, and 1 IS course, again, a minimum GPA. But the difference in the prereqs between the two is you must hold a BSN or equivalent degree in order to qualify to be enrolled in the nursing informatics. And you can see just listed a salary difference right there. You can see your BSN in nursing, that's an average salary. Your BSN with the health informatics certificate, you have potential to make in, somewhere in the neighborhood of $20,000 to $25,000 more per year. Okay, Wes, thanks. We do have affiliation agreements, which means it's nothing more than myself working behind the scenes to make sure that we have agreements in line with Cabell Huntington, St. Mary's, HIMG, CAMC. I have students right now in their 400-hour practicum. I have them at CAMC. I have them at Cabell Huntington. I've got them at the Cabell County Health Department. So I have them spread out pretty good, across the tri-state area. And some of them will be outside the area, and especially with the virtual situation we've had to live under, then it has become quite I had to be kind of creative in some respects, in order to get the students or the credit hours they needed. But this is a 400-hour practicum, and I think there's another slide coming up in just a moment that will help, that I will explain this a little bit further. But I do have to have, and the university has to have, affiliation agreements, and I take care of every bit of that. I mean, it's just something that I do. I make sure that these are in line before I send a student out somewhere. I make sure that that agreement is in place and up to date. Wes, okay. Your practicum. It's HIN 650. It's 400 hours. It's required. And it has to have my approval in order to be signed off on. You cannot register for this course by yourself. You have to go through me. I have to get a hold of Mr. Spradlin and say, he is good to go. She is good to go. Register them, please. Now, this course can be taken fall, spring, summer one session. It can be taken at any point in time, but you must get 400 hours in, and that is clocked hours. And obviously that can include many things. You might set in on 2 days worth of meetings and get 15 hours of time in, but in order to learn how to do the health informatics for that particular function that your facility that you're at, you may have to have those meetings. Now, we prefer that you have these courses listed: HCA 600, 605, 615, IS 623, and EM 660. We actually prefer you to have these courses completed, and you're done with them, in order to be able to qualify you to get into a health informatics practicum. And I'm not saying you have to wait till the very end of your program to do the practicum. You don't have to do that. But if you can, and this is one of the first things I will look at: do you have these courses? And if you do, then I will strongly consider your request to see where you want to see where you can do a practicum. Now, I will tell you, I help students get enrolled in these practicums. Sometimes students get hung up and say, well, where can I go? Well, I do have contacts across the tri-state area and with various hospitals and organizations where I can possibly get you in. I'm not saying it just because I recommend you that you will get there, but I do have some places that I can possibly help you to get in. Wes, please. Mr. Byros had mentioned the independent study course. It's 685 to 688 HIN. It can be 1 to 4 hours credit. And as Mr. Byros alluded to, it can be something that interests you. You may want something that's some kind of certification, and that most generally is what students go after. And you can see my third bullet point says, you can earn a certificate in an area of health informatics or something that is beneficial to you. And you could go through Tableau, Coursera, LinkedIn. I have a couple of students right now. One just finished it up, but design principles for Tableau. They just finished that certification. Visual analytics in Tableau. You can get all kinds of topics out there, but again, I must approve it. You can't don't assume that it's going to be okay. You have to make sure that you that you approve it through me. Wes will not register you unless he receives my approval. Now, I see Dr. McInerney, one of our colleagues, has sent a question in, and I'll go ahead and address that question right now. She asked, is this a paid practicum? That, or in whatever you're doing, the paid practicum situation in the 650, that is entirely between you and the facility you're doing your practicum at. If they choose to pay you, that's wonderful. If they choose not to, then it's out of my hands. I have nothing to do with that. So a lot of people, some students do get lucky. They will find an opportunity to get a practicum, even if they're only making $10 or $12 an hour, it beats zero. So, some students do manage to get that. Thank you, Dr. McInerney. But obviously the last bullet point, if you're going to do 685, 86, 87, or 88, most students just do the 685. They opt for the 1 credit hour, which is something beneficial to them. It looks good on their resume. If you wanted to do 686 and get 2 credit hours, 687, get 3 credit hours, or 688 and get your 4, obviously the higher up in the course numbers you go, the more work is going to be required of you. So 688 for 4 hours credit is probably going to require you to do quite a bit of work. It's going to be extensive. So I be honest with you, I have been coordinator for 3 years, and I have never had anybody request anything over 687, or excuse me, 686. I've never heard of someone wanting 3 and 4 hours. Next slide, please, Wes. Okay, Mr. Spradlin, it's your turn.
Thank you, Dr. Willis. My name is Wes Spradlin. I'm the Associate Director for the Brad D. Smith Graduate School of Business, and I'm just going to cover the admissions process. It's actually a pretty painless application process as far as most graduate programs would go. Basically, you need to fill out the application, which can be found on the graduate admissions webpage. You can either do it electronically or you can print it off and mail it in if you prefer to do it that way. There's also a $40 application fee that's required for any graduate program application. So you would need to also submit that, and also your official transcripts. So if you're a Marshall student, you're getting your degree from Marshall, admissions will be able to just pull those for you. But if you'd actually had your bachelor's degree from somewhere else, or maybe you'd taken some classes from different universities, you would have to have those transcripts sent directly to Marshall's graduate admissions office to add to your application packet before your application would be complete and ready for review. Finally, if you're applying as an international student, you would also have to submit some additional documentation, such as potentially, IELTS or TOEFL or some of your English proficiency exams, as well as a financial guarantee, and then some other documents there. And what I would advise for that, if you're applying as an international student, get in touch with me and I'll be happy to put you in contact with somebody from the admissions office, and they would be able to give you a full list of all the requirements there. And as far as the GPA requirement, we do require a 2.5 overall GPA for admission to the program, which is it's a requirement for any full admission to any grad program at Marshall. So like I said, it's a pretty straightforward application process. Basically, the application, the fee, and transcripts if you're a domestic applicant. And with those, we would be able to, like I said, look at your file and then make a decision on your admissions status. I'm going to pass it back over to Dr. Cristofero, and she's going to talk to you about some employment opportunities.
Thank you, Wes. Dr. Willis had listed several employment opportunities during his discussion, but take a look at the variety that we have here. Anywhere from being in a clinic, being in a hospital, working in a corporation or for government. There are many, many in addition to these types of employment opportunities that are available to you with this type of degree. Let's also take a look at some of the job titles. If we can move to that slide, Wes. Thank you. These are some of the titles of the health informatics graduates and some of the professionals in the field. And again, look at the variety of things that you could be doing. It is focusing primarily on using science to optimize the value of medical data, but there are all kinds of job titles you can have. And what I want you to really pay attention to is look at the last line. And this actually is worth me reading it out loud to you. To date, Marshall's Health Informatics graduate program has a 100% job placement rate with salaries of graduates between $50,000 and $125,000 a year. This is serious stuff and definitely confirms that the jobs are out there and that Marshall is really the place to go. It's the program to enroll in so you can get those skills and that knowledge in order to land those types of jobs. So with that, I'd like to ask for any questions that have or have not made it to the chat. And here is our contact information for Wes and for Dr. Willis if you have further questions. Thank you.
There currently are, oh, here's a question. So this question says, many thanks, or it might not be a question, but many thanks for your presentation. Our firm, Gateway to Health, LLC, will soon be part of the business incubator at Marshall University. We deliver remote health monitoring solutions for patients with chronic disease designed around the cloud. We are very interested in working with the Health Informatics program to take us to the next stage of predictive clinical analysis and decision making. We look forward to constructive collaboration. But we currently do not have any questions. Unless anyone would like to ask them now, they can do it via the chat function. And if not, right here is the contact information for Wes Spradling and Dr. Kent Willis.
Apparently, we must have done a really good job explaining all of this.
My thoughts exactly. I thought, hey, leave no room for doubt. That's it. It really is a good program. It is, and it's got potential to grow. I mean, and it's we're just looking at it, and we just have to kind of make sure that we encapsulate everything that's possible. And I think with the addition of Dr. Christopher, we're going to have some positives there. We got a question popped in down here. Oh, it says, thank you, very good information.
Yes.
there
Are
any-
there any changes in the program this year than from previous years?
There haven't been any changes as far as the curriculum goes, other than we with the transition of moving some of these programs into the College of Business, some of the abbreviations have changed on the title. And as Mr. Virus had mentioned, we're constantly changing the makeup of each course as the as the field changes and the demand of what's needed changes. So as far as actually replacing courses, that hasn't been done this year, but like I said, we are constantly tweaking what's taught in each course to make improvements as we go. Were there any other questions?
Avi, do you have anything you'd like to add to it?
Well, I guess if there's no other questions, we appreciate everybody joining us today. And like I said, Dr. Willis and myself's contact information is here. So if you have any questions that you think about down the road, or you want to just maybe get some discuss further, feel free to reach out to either one of us, and we'll be happy to talk with you more about the health informatics program.
Okay. One last thing on my contact information. I am very, very seldom ever in my office anymore. So if you would, please email me or get in touch with Wes, and Wes can get in touch with me, because sometimes this 696 number, you could call me and I might not see the call for 2 or 3 weeks. So if you would, use my email address. Thank everyone for their participation, and thank everyone that was out in our audience. Everyone have a great evening.